Some might describe Narcan as a miracle drug for those suffering from opioid addiction. The state of Arizona has taken steps to make it easier to get. But as investigative reporter Meghan Finnerty discovered, it's not as easy as some were led to believe.
It sounded so easy. You don't need a doctor's prescription anymore to get Narcan to a loved one or friend suffering from an opioid addiction. Just go to your local pharmacy. But like many great ideas, right now this one is bound in red tape. Getting this drug quickly and easily into the hands of those who need it has been a long time coming for advocates.
If it wasn't for Naloxone, I wouldn't be here today.
Naloxone, or Narcan, has only one function: to save lives. It reverses an opioid overdose of drugs like heroin or oxycodone.
I said in the last 2 years we've noticed that we've had to use it a lot more often. It's really hard to put a time frame on it. I've had it anywhere from using it once a month to 3 times in 3 hours in a day.
Our state has suffered so much from this opioid epidemic. I think people are ready for some new solutions.
To do its part, the Arizona legislature added police and EMTs to the ranks of first responders allowed to administer the drug in 2015. 1 year later, lawmakers permitting friends or relatives to get prescriptions for loved ones, and gave the pharmacist the ability to dispense the drug without a prescription. But instead, Cronkite News has found the availability of Narcan mired in misinformation and confusion.
There was a point where the doctors didn't even know you could prescribe it.
The Arizona Board of Pharmacy created laws allowing pharmacists to dispense the drug without a prescription after proper training. The problem is they're not required to get the training in the first place, and there's no easy way for the public to find out who's qualified to dispense the drug.
The issue is that it's so recent that these changes have been made that a lot of people aren't aware of what Naloxone is. They aren't aware of where to get Naloxone, how to use Naloxone, or even that they can get it.
So to cut through the confusion, groups like Sonoran Prevention Works have started going to those who need it instead, bringing free education and Narcan to the people.
Yeah, it's completely free. So our trainings, our technical assistance, and our Naloxone kits are free.
Michelle Scambalori of the Navajo County Public Health Department invited Coles to teach about Narcan on a cold winter afternoon in Show Low. The crowd was small, but the message important.
And I wanted people in the community to see that passion and hopefully have it translate over to how they saw substance use in the community, and that it wasn't just a moralistic issue, that we wanted to keep people from dying, because it is preventable.
And as the state continues to sort through the red tape, this group of friends who met in recovery will continue making free kits, knowing Narcan may save others just like it saved some of them.
If you say getting Naloxone in the hands of people that are actively using isn't important, then you're saying my life isn't important. And I help people today, and I love people today, and I'm a contributing member of society.
Emergency services say after using Narcan, you should still call 911 because it's possible to overdose again. Advocates want the community to know overdosing can be a fatal side effect to a mental illness of addiction. In the broadcast center, Meghan Finnerty, Cronkite News.